What happens if I don't get herpes treatment? Herpes is an STD, sexually transmitted disease caused by the HSV herpes simplex virus. Herpes currently has no cure, so treatment is the only option for dealing with outbreaks of the virus. Herpes is not a life-threatening disease, but it can cause a lot of discomfort. There are two types of the herpes simplex virus. HSV-1, this type of herpes commonly causes cold sores. Recently HSV-1 has been found to cause genital herpes due to mouth-to-genital oral sex. HSV-2, this type of herpes most often causes genital herpes. Mouth-to-genital contact can cause infection in the mouth. How can I get herpes? HSV-1 is spread through contact with saliva. When you kiss someone, have oral sex, or share items that have saliva on it, you are at risk for catching herpes. HSV-2 is usually caused by sexual activity and direct contact with infected genitals. It can be passed by genital-to-genital contact, vaginal sex, mouth-to-genital contact, oral sex, and genital-to-anal contact, anal sex. Signs of herpes infection and outbreaks: blisters around the mouth, irritated, cracked, red skin around the vagina, penis, or anal area, itching or tingling sensations around the vagina, penis, butt, anal area, and thighs, open blisters, causing painful sores around your vagina, penis, anal area, butt, and thighs, painful feeling when peeing due to urine passing over the area, headaches, backaches and muscle aches, flu-like symptoms, including fever, swollen lymph nodes, and fatigue. If you experience any of these symptoms, you should get tested for herpes if you have not already been diagnosed. If you experience any of these symptoms, you should get tested for herpes if you have not already been diagnosed. The virus makes a home in your body. When you get infected with herpes, the virus enters your skin where it travels through your body along nerve paths. It hides. You may or may not experience herpes symptoms depending on whether the virus is active or dormant, inactive. If the virus remains dormant, it will stay in the nervous system indefinitely. Return trip to the surface. If the virus becomes active, it will travel back along the nerve paths to the surface of the skin. The virus then sheds on the surface of the skin. You may see symptoms of an outbreak due to the shedding of the virus, or it can go undetected. Transmission. Whether you can see the symptoms or not, the virus can still be easily passed if someone comes in contact with the infected area. You are most likely to transmit herpes during an outbreak. Dangers of untreated herpes. Even after being diagnosed with herpes, some people are reluctant about getting treatment. You may be embarrassed of people finding out, or you may be scared to get treatment. Untreated herpes comes with many health risks, so your best option is to visit a doctor or healthcare professional to start treatment as soon as possible. Know the risks of untreated herpes. Herpes is very contagious, and if you do not get treatment, your chances of spreading it are higher. Infection may spread to other parts of the body, and cause increasing discomfort. If you are pregnant, untreated herpes can be harmful during childbirth. You may see outbreaks more often. Your outbreaks may be more severe. There can be complications related to a suppressed immune system. If you have cancer or HIV/AIDS, or you had an organ transplant, seek medical help right away. Increased risks of getting HIV/AIDS and increased risks of transmitting HIV/AIDS. Herpes treatment is most often taken in a pill form, but can be taken intravenously, through and for, in certain cases. The treatment helps to reduce the number of outbreaks and severity of the outbreaks because the medication affects how the virus reproduces. The medication is most effective when it is used at the beginning of an outbreak where you experience itching, tingling, and redness. Herpes medication. Zovirax, medical name is aciclovir, Famvir, medical name is famciclovir, and Valtrex, medical name is valacyclovir. These medications have very low side effects. The cost of medication can vary depending on your insurance coverage plan, the amount of medication you need depending on the number of outbreaks you have, and whether you get a generic or name brand form of medication. Discuss with a healthcare professional and your insurance company for prices and plans. Aciclovir is covered by medical insurance in many parts of the world and is the cheapest option. Can herpes be transmitted to other parts of my body? After the initial infection of herpes, when you first get infected, the virus cannot spread to other parts of your body. By this point your body has made antibodies to prevent the spread of the virus. You can get infected by the same herpes virus in multiple locations at the time of infection. For example, if you are having sex with a person that is infected, and you have genital and oral sex, you are open to catching the same virus in two different locations. Can I get herpes on my arms, legs, or other parts of my body? The herpes virus itself cannot be transmitted to other parts of your body after your initial infection, but sores caused by herpes can infect your arms or legs. This is most common with patients who have weakened immune systems. This is called disseminated herpes, and if you experience this you should contact a healthcare professional immediately, because this can be very dangerous. Tips to help prevent the transmission of herpes: always wear condoms. Keep your number of sex partners low to reduce the chances of transmitting the disease. Make your partner aware that you carry the virus before you have sexual contact with him/her. Get treatment for herpes, especially during outbreaks when you are at a greater risk of spreading the virus. If you want to have sex with your partner without condoms, talk to a health professional about taking a suppressive therapy to reduce the chance of transmission by 48%. If you have an outbreak, keep the area covered, and wash your hands after touching the infected area.